There are about 68 million Americans enrolled in America.
Medicare.
And over half of them are enrolled in a Medicare Advantage plan, also known as Medicare Part C. And on the surface, it's easy to see why these plans are so appealing. Most Medicare Advantage plans offer very low or even $0 monthly premiums, built-in prescription drug coverage, and of course additional benefits like dental, vision, and hearing. But what many people don't realize until it's too late is that Medicare Advantage plans are sort of pay-as-you-go plans. That means that you could end up spending thousands of dollars on a yearly basis, perhaps $5,000, $7,000, or even $10,000. So in today's video, we'll break down why Medicare Advantage plans can be expensive fast, why medical debt is exploding among seniors, and why Medicare supplement plans, while more expensive monthly, are often far more predictable and safer long-term. So let's start with some numbers. Over 100 million Americans report having some type of medical debt, totaling over $220 billion. About 15 million Americans have medical debt that has gone to collections, meaning it can appear on credit reports. Now here's the part that really matters for Medicare beneficiaries. Studies indicate that many seniors have less than $2,000 available for emergency funds. And unfortunately, with out-of-pocket maximums for Medicare Advantage plans usually totaling far over $2,000, that means that many Americans utilizing a Medicare Advantage plan would not have the emergency funds available to pay these medical bills. This is why understanding how Medicare and Medicare Advantage plans work is so very important. Now, there are three primary ways in which you can use Medicare. Each comes with different risks and, of course, different financial ties. First is to utilize Original Medicare alone. Original Medicare is Part A, which is your hospital insurance, and Part B, which is your medical insurance. Now, they will cover most of your medical needs with some notable exceptions. There is no out-of-pocket maximum with Original Medicare, and that really is its biggest drawback. That means that should you incur major medical expenses, there is no annual threshold on your medical spending. However, it is an open network. As long as your doctor accepts Original Medicare, and almost all do, you should have no issue finding doctors, specialists, and hospitals to work with. Then there are Medicare Advantage plans. These are managed care plans, also known as Part C. Now, generally speaking, Medicare Advantage plans will have very low monthly premiums or possibly no monthly premium at all. You will, however, need to continue to pay for your Part B. There are benefits of Medicare Advantage plans, additional benefits, as well as that out-of-pocket maximum that isn't offered by Original Medicare. Unfortunately, Medicare Advantage plans operate within networks, HMOs, and PPOs, and it can be more difficult to find doctors and specialists and hospitals who accept your plan. There's also that major issue of pre-authorization. Because these are managed care plans, between you and your doctor and the treatment and service that they recommend stands your insurance carrier. They must first pre-approve the treatment or service, and that can be a bit of a headache. And then there are Medicare supplement plans as well as Part D plans. So one of the additional major drawbacks to Original Medicare is that it doesn't offer prescription drug coverage. For this, you will need a standalone prescription drug plan, which is Part D. Additionally, if you are looking to keep the flexibility of Original Medicare, but impose some additional financial protection, especially an out-of-pocket maximum, then a Medicare supplement plan, also known as a Medigap plan, can step in to fill those financial gaps. Let's break it down a little further and talk about some costs. So with Original Medicare, as I just mentioned, there is Part A and Part B. These are two separate parts, they're billed separately, and of course there are different copays and coinsurance associated with each part. Now, generally speaking, there is no premium for Medicare Part A unless you or your spouse haven't qualified through your work history. For Part B, there is a monthly premium. It's determined by your income, but it's hovering around $202.90 as the base beneficiary premium. Of course, it can be more, again, based on your income. For Part A, you'll have a deductible to meet, and that is not an annual deductible, but rather per benefit period. So if you have multiple hospital stays, you may have to meet that deductible more than once in a given year. And then your copay is determined by the facility in which you are receiving treatment and the length of stay. Now, I don't mean the hospital name. I mean whether it's a hospital or a skilled nursing care facility or hospice care, home health care, etc. For Part B, it's a little easier to understand. There is a once annual deductible, and once you've met that, generally speaking, your portion is just 20% of the Medicare approved amount. Now, that 20% of the Medicare approved amount for doctor's visits probably isn't very much. Of course, it can be significantly more when we're talking about things like X-rays and MRIs. And of course, there are the costs associated with Part A, your hospital insurance. These are far more significant. It can be hundreds of dollars per day, depending upon your length of stay and the type of facility that you're in. And that's why the fact that Original Medicare doesn't have an out-of-pocket maximum is so very problematic. Because if you are diagnosed with a serious medical illness and need to be hospitalized for an extended stay, that can be, just quite frankly, completely breaking you financially, thousands and thousands and thousands of dollars in medical bills. So if you are facing treatment for cancer, or you have a stroke or need open heart surgery, you could have a medical bill of $300,000. And let's say that's billed to Part B. Well, yes, Medicare is going to cover 80%, but you still have that 20% coinsurance, which could leave you with a $60,000 bill. And considering most seniors only have up to $2,000 as a rainy day fund, that really isn't going to cut it. And that's why many people look towards Medicare supplement plans or Medicare Advantage plans. Now, Medicare Advantage plans offer you slightly less risk than Original Medicare alone. Of course, there are drawbacks. So Original Medicare, as I mentioned, doesn't really have networks. However, Medicare Advantage plans do. And they can be rather restrictive. There are issues with pre-authorization and contract negotiations regarding payment for Medicare Advantage plans, and many physicians and hospitals have just been jumping ship, and fewer carriers are willing to offer Medicare Advantage plans as well. So this is problematic. If you are in need of serious medical treatment and you need to see specialists, you really want to be able to have your pick and see the best of the best. And if you can't find one that is willing to operate within your network, you could be on the hook for the entirety of the bill. As we've already discussed, those bills can be rather significant. Now, of course, you can opt for a PPO, which will give you much, much more flexibility. However, there is always that issue of pre-authorization. I touched upon this earlier in the video, but I cannot stress enough how much of an issue this actually is. Pre-authorization, that means that if your doctor recommends that you receive a treatment or a service, you can't just go get it. Your insurance carrier must first approve it, and this can be extremely problematic. Now, many insurance carriers require a tremendous amount of paperwork, leading to delays or possibly even denials of the treatment or service that you may need. This is why Medicare Advantage plans are very often great for people who are younger and healthier. They have low monthly premiums. They offer all these additional benefits. But if you're someone with more extensive medical needs, then a Medicare Advantage plan probably isn't right for you. Unfortunately, by the time you realize that Medicare Advantage just isn't suiting your needs, it may be very difficult to make the switch to a Medigap plan instead. And that's not the only issue. Even though there are out-of-pocket maximums, and I cannot stress how important that is, those out-of-pocket maximums may just be too high. For an HMO, you could be looking somewhere between $3,000 to $5,000. For a PPO, it could be $5,000 to $10,000. And for someone living on $25,000 to $45,000 a year, a $10,000 medical bill could be completely devastating. Now, despite this, Medicare Advantage plans are still extremely popular. However, if you are going to go the Medicare Advantage route, we highly recommend that you work with a broker. Unlike Medicare supplement plans, which we'll discuss in just a moment, the benefits of Medicare Advantage plans vary widely. There is such a plethora of different options available, and it can be very difficult to choose the best possible plan for your needs. So if you do need our assistance, you can reach us in the comments below or at the number on the screen. We're licensed health insurance brokers, and we're licensed nationwide, and there's absolutely no charge for our services. Now, we do release these videos on a weekly basis, so please make sure to subscribe to stay up to date and make sure to like this video so we can get it out there. All right, let's get back to it. Now, finally, I want to talk about Medicare supplement plans. Medicare supplement plans, also known as Medigap plans, are sort of the Cadillac, the gold standard of Medicare plans. That's because they'll offer you the full flexibility of Original Medicare, but you'll have the additional protection with out-of-pocket maximums or covered copays and coinsurance and deductibles to make sure that you have some type of cap on your yearly spending. Medicare supplement plans are offered by private carriers. However, if your doctor accepts Original Medicare, they will accept your Medicare supplement plan regardless of the carrier. That's because Medicare supplement plans are simply a financial solution. They are there to help cover the deductibles, copays and coinsurance, and possibly impose an out-of-pocket maximum. There are several different plans to choose from with varying price points as far as your premiums and varying levels of coverage. If you choose something like Plan G or Plan F, then basically all of your out-of-pocket costs are covered for the year. There are, of course, less expensive plans, things like Plan K and Plan L, which are cost-sharing plans. They'll cover a portion of your cost share. There's also high deductible versions of Plan G and Plan F, which also offer lower monthly premiums. So there are ways to sort of still have that financial protection and shop for a plan with a lower monthly premium. That's because these plans, especially when compared with Medicare Advantage plans, are more expensive. You could be looking at a plan with up to a $200 per month monthly premium. However, when you run those costs and compare your total monthly premiums and add those out-of-pocket costs, which are probably completely eliminated, you may find that a Medicare supplement plan is still the best option for your needs. If you want to learn more about how to compare the different plans available, I highly recommend you check out this video over here to learn about all your different Medigap options. Of course, if you have questions, you can reach us in the comments below or at the number on the screen. We're licensed health insurance brokers, we're licensed nationwide, and there's absolutely no charge for our services. And before you go, make sure to like and subscribe. We'll see you next time.